Hey everybody! So every time I come on, I always say it's been a minute since I've posted, and then sometimes I'll look at the post before the one I'm going to do, and I'm like, oh, it wasn't that long ago. But in this case, it's been a while. A lot has happened. I lost my home. I've downgraded from my home to an apartment to a bedroom. The first 3 months of 2020 have been extremely trying for me. In the midst of that, coronavirus came about. As you guys know, I am in the health field. I am in the medical field. So it has been miserable. I don't know if you guys can tell, I am not sleeping at all. Work has been insane. Like, it's really been insane. So I'm coming on basically, just to give you a little insight, because those of you that do not work in the medical field have no idea. Again, you folks have no idea what we're going through. Just a little bit of education for those of you that don't know, or for those of you who wish to take this lightly. This virus is a virus that causes sickness like a common cold. And for those of you that don't know, this stemmed back in December of 2019, this past December, and it was seen in China, in Wuhan City. And, this doctor was telling everybody this is a serious strain, and if you folks don't act quick, it's gonna get crazy. He warned people, and sadly, the virus killed him. So now, they're calling this virus COVID-19. For those of you that don't know what the symptoms are, these symptoms include fever, cough, stuffy nose, runny nose, shortness of breath, trouble breathing. Most people carry these symptoms, but they're mild. And it doesn't necessarily mean you have COVID. So you have to be extra mindful of yourself, especially those of us with autoimmune disease. Some of you are probably trying to figure out, she's got lupus. She's taking all these medications. She's on chemo. She's trying to keep herself healthy, and she's working in the medical field. Well, you guys, I took an oath before I got lupus. So I'm doing everything in my power to keep my immune system the way it should be. I am taking my medications, so I'm doing what I have to do. Aside from that, a lot of people ask how do we stay healthy? So the risk of getting COVID-19 in the United States, they say it's very low. I don't agree with that, because we had a serious outbreak in Westchester County, where I currently reside and work. So I don't know about that. I really don't know how to answer that question when people ask me, but I do tell everybody, as this is just a really bad case of the flu. You want to stay healthy? Wash your hands, soap and water, 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 soap and water. If you are not anywhere near a sink, hand sanitizer. Hand sanitizer, hand sanitizer, hand sanitizer. And you know what, you guys? If you cannot find hand sanitizer, make your own. 90% based alcohol, aloe vera gel, and any kind of essential oil just to, moisturize your hands and prevent your hands from cracking and getting chapped. Avoid close contact with people who are sick. In other words, if somebody's sneezing, if somebody's coughing, if somebody has a fever, stay away. Stay away. And if you're sick, stay home. Stay home. I cannot stress this enough. I am at work to help you folks. If you folks want to help me and mine, please, if you're sick, stay home. I cannot emphasize that enough. If you're sick, if you have an allergy, if you happen to get a little tickle in your throat that forces you to cough, a little tickle in your nose that forces you to sneeze, please do me a favor, have a tissue handy. Cough or sneeze in your arm. Don't spread your germs out there. Come on, people. Come on. Save a life. Keep your germs close by. Okay? Yeah, and clean. Clorox, disinfected. Just wipe down as much as you can. Where I work, the hospital I work for, they're following serious directions from our local and state Department of Health and Centers for Disease Control and Prevention. A lot of our medical colleagues, where a lot of us are trained to recognize patients who may have the COVID infection, and we know what to do to keep the virus from spreading. It's tough. This is trying times. This is very challenging. This has definitely gotten in the way of people's lives, and this is gonna be life until things lift and get better. So this is not going to be forever, you guys. We are going to get through this. I'm hoping that the information and a little bit of knowledge I'm giving you is helpful. I do tell everybody, if and when in doubt, go onto the website, and there's a section in the CDC link where you can actually email people. So please, you wanna go into the infection prevention control, and there's a section there where you can email these people with any questions or concerns you may have. Somebody will get back to you. You guys, be safe. If you don't have to go out, stay home. If you choose to go out, social distancing is kind of a pretty dope thing, I'm not saying, don't go out or don't invite anyone, If you're gonna be with somebody, hey, you have autoimmune disease, people, okay? My page is for everybody, but mostly directed for people who have autoimmune disease. So, you know what? If you're going to invite people over, make sure it's about 10 or less. Make sure when they come in, you have them take off their shoes and leave it in front of your doorstep. Make sure they wash their hands. And make sure they don't touch anything, cough into anything, sneeze into anything. If that's the case, there's the door. Okay? Protect yourselves at all times. I cannot stress it enough. Again, I'm okay. Shockingly, the stress It's slowly getting to me. These days I don't have an appetite anymore. And it's just really, really overwhelming. And I thought, let me just take a quick breather and let you guys know what's going on. So, yeah, you guys, simple protocol. If you follow simple protocol, you'll be fine. Before starting this video, I just washed my hands. And look, when you apply this onto your hands, folks, rub, rub, rub until it is dry. Do not rub and let it sit there on your hands, because it's not gonna work. It's not gonna work. Okay? It won't work. I don't know what else to tell you guys. Be well, stay healthy, stay clean, and until next time, take care.